What can I do to slow aging before it actually starts? And what treatments actually build collagen? That is the biggest question. Minimally invasive procedures are taking center stage. Long gone are the days when people want something where they have to hide for 2 or 3 weeks. Now they want to look natural. They want enhanced natural beauty. Our skin is a living and breathing massive organ that's constantly being attacked, that's constantly adjusting. We're always adapting to the changing needs of that person in their life, as well as what their skin is showing that is of need. So I'm gonna introduce you to something that's really quite exciting. You are gonna see a demo today. Just so you know, you can microneedle with this device with absolutely no numbing, and I highly suggest you do not numb. And I can do a full face in 4.5 minutes. One of the reasons I'm here is to show you an incredible device that I personally love and used a lot in my clinics, a microneedling device, but I also want to discuss with you certain things about industry trends, maybe what our consultation may or may not be doing for our patients, but also the other amazing elements that we have in our clinics, like IPL, RF microneedling is a big thing too. They all have their place. I'm a big advocate that we use everything that we have spent our money on in our clinics. But also, I want to make sure that we have a clear understanding of why we're using those things. Sometimes, unfortunately, I find, and you might not find this, but I find, when you speak with someone from a manufacturer, you get the glory story. But in practical terms, we might not get the true hardcore in the field knowledge and understanding of really what we want to look at. So we are going to be talking about microneedling, industry trends, how do we optimize consults and services, and the Dermapen for technique and a demo. One of the things I teach in my advanced courses for medical aesthetics at our Miami Center is definitely how we actually do a proper skin analysis and consultation. We're also busy that I think it's a forgotten art. And we may not ask the right questions a lot of the times because we're on that clock. So we're going to talk a little bit about this. We want to make sure that when we are working within our industry, in our clinics, we're also understanding what's being asked by the consumer and why they're asking for that. Minimally invasive procedures are taking center stage. Long gone are the days when people want something where they have to hide for 2 or 3 weeks. We already noticed a downtrend in major facelifts years ago. We also noticed a downtrend in deeply invasive surgical procedures. Even threads are starting to become something that people are a little concerned about and worried about. Granted, I understand why. But when you look at what is going on in our industry year over year, look at the year 2033. Minimally invasive treatments are on the uptick, and I get it. Also as consumers, we are also still consumers. So I like to think about, okay, if it's not working for me, I can on 99.99% guarantee it's not working for my patient, Mrs. Smith or Mr. Jones, guaranteed. So what patients are asking for today in the aesthetics consumer is quite powerful. Long gone are the days that they want to look like they've been in a windstorm, right? Now they want to look natural. They want enhanced natural beauty. But the bigger thing here is minimal downtime, and the biggest thing to me is prevention and longevity, not just correction. That speaks volumes to the type of services that we have in our clinics and what type of services are going to give that true indication of such. Most common requests, and I know you're hearing this, I want my skin to look better without looking overdone. What helps with texture, pores, acne scars? That is a big deal. Acne scarring is something that scars someone's psychological element in their life for years. It can stop them in their career progression, even in relationship building. What can I do to slow aging before it actually starts? That's a big one. Guess what? The 20-year-olds are already talking about that. Why do you think that they're asking for talks? Okay, let's give them some fulfillment answers. And what treatments actually build collagen? That is the biggest question. And that's what I'm here today to really deep dive and discuss. There's a lot of physiology and histology of the skin that unfortunately we don't get educated on anymore, and it annoys me. When I did a lot of my training, I did well over 7 years of training just in skin. We need to understand what our devices do and what kind of collagen they're actually replicating. Because why would we want collagen 1 comparatively to collagen 6? Good question. And this is a great consultation opportunity. Position combination therapies like regenerative RF and microneedling and IPL and peels and all of that has a place. So let's make sure that we're utilizing it properly. And we want to educate on collagen stimulation versus instant results. I was just having a conversation with my comrade, and she said that she actually had a demo with a medical clinic, and they're like, yeah, well, we didn't really see that great results. It was one treatment. Gone are the days where we have to literally ablate your whole entire face and burn it off in order to get great results. You want longevity, you want collagen remodeling, we got something for you. And we want to shift the conversation from single treatments to long-term skin plans. So the proper medical skincare consultation is really powerful. We all know about medical consultation forms and actually doing contraindication forms and actually doing the true assessment and evaluation of the skin. This is where we got to go because it now leads into lifestyle and compliance habits, sun, heat. As a practitioner, I also went into things like holistic nutrition. I'm a master holistic nutritionist. Why? Because your skin directly is affected by what you eat, not just what you put on it. There's a reason for that. So we want to know what their lifestyle is. Do they sleep 2 or 3 hours a night because they're constantly working? Do they have twins that are 3 years old? Well, that's directly going to affect their skin and their healing opportunity. 100%. Their wound healing cascade is completely different compared to someone who sleeps 7 or 8 hours a night. It is imperative that we ask these questions. And it's imperative that we also give a treatment pathway so that they understand that there's hope. We're not just giving a one-time fix. We want patients for a lifetime, do we not? So diagnosis, risk mitigation, sequencing treatment. Now, this is the key. Devices are a step, but they're not the start. Okay. The importance of a consultation is not to be done just once. Let's say you have a patient for 2 months and then all of a sudden she's pregnant. Is her skin not going to be reacting differently? So we always have to have that consistent conversation. And this is why I always say we're in the relationship business. Now, skin analysis and proper consultations, they're very much overlooked. One thing that I always said to my patients is I'm going to be annoying. I'm going to be a thorn in your side because I'm going to ask the same questions probably for the next 10 years. But you're definitely not going to give me the same answers. So this is what we want to make sure. We're always adapting to the changing needs of that person in their life as well as what their skin is showing that is of need. We also want to make sure that we have the early detection and prevention opportunities. So selecting the correct treatment for your patient, it actually starts with those queries. Our skin is a living and breathing massive organ that's constantly being attacked, that's constantly adjusting. So what questions should we ask? Clearly, we know the simple ones: medical history, medications, medical concerns, maybe what have they tried, but we can actually go deeper into this query in order to really get some feedback to make sure that we can get them on the right track. So let me introduce you to a company that I have mad respect for, which is Dermapen World. Dermapen World is the company that created the first automatic microneedling device well over 15 years ago. And I will be very honest, everybody's tried to copy them. Their technology is so patented, it's just impossible to copy. I actually work for the US distributor, the only US official distributor for Dermapen World. It's DP Derm. I'm clearly labeled with them today. So one of the things that Dermapen World has done is they literally have 40 plus years in medical technologies, medical equipment manufacturing technologies. So for them to go to something quite as quote unquote simple as microneedling, it isn't as simple as microneedling. So I'm going to introduce you to something that's really quite exciting. You are going to see a demo today. Just so you know, you can microneedle with this device with absolutely no numbing, and I highly suggest you do not numb. And I can do a full face in 4.5 minutes. Yeah. You have 0.2 to 1 millimeter depth in tenths, and then you go to quarters, and then you go to halves, and you can go to a dedicated 3 millimeter dedicated scar treatment. I've worked on keloids. I've worked on scars that are contractures. My history is working on burn victims. The Dermapen revolution, as you can see, it literally looked like a pen. I don't even call it a pen, I call it a device. It is a class 3 medical device. It is FDA cleared. It was the first FDA cleared device. I'm going to tell you a few little nips and tricks about this device, and I'm also going to tell you why it's so powerful, not just the device itself, but the needles at hand. We have a protocol book that you will not see in any other market. And just so you know, that protocol book has been created as protocols because we have skin experts around the world internationally, and there are millions of treatments that have been done with those protocols with extreme effectiveness. So we clearly have a completely different device. We have advanced oscillating vertical needles. These needles are direct drive. With a roller, you're going to actually pull, drag, tear on the skin, and you're never going to get proper depth, correct? It's just impossible. When you have direct drive motion with the needles, you are literally making sure that every single time that you are getting those needles into the skin, it's of absolute precision, because this device baselines to 0 every single time you change the depth or the speed. What does that mean for you? As a practitioner, you can needle right over the eyelids. You can needle right over the lips. We also have the high-speed puncture. Now, what is more important? Creating a little bit of trauma in the skin, or creating a lot more trauma in the skin so that it actually wants to heal, but at a nominal level? We want to create the wound healing cascade effect, right? Our device is so proprietary. You're creating 1,920 puncture channels per second. The other devices on the market are 600. We also, in one treatment, let's say to the jawline, it's about 1 million microchannels. How amazing is that for the microinfusion of biologics? We want those ingredients to get to the cellular level. So not only do we have a proprietary blend of tech in the device, tech in the needles, we also have tech in our glides. We have a glide medium for acne, glide medium for aging, glide medium for alopecia. We have a glide medium for pigmentation issues. We have it so that you can either blend what you want or use what we have. There's options. You like to do PRP? We got an amazing glide medium to mix with that. They just got a major boost. Now, they are surgical stainless steel needles with 0.0000089% nickel. So for those patients that might have a metal allergy, in millions of treatments around the world, we have not had one incident, a metal allergy issue. So that's quite wonderful for someone that I love to microneedle on. I personally have done a full face, a full neck, a décolleté, a huge keloid on the shoulder, and a big tummy tuck scar with one needle, and did not have any dragging, pulling, tearing. You will not have any granulomas. You will not have any bruising. You will not have any track marks with this needle. You do not get suction with this cartridge at all. Collagen 1 is what makes up practically everything in our body. Our eyeballs, our eyelids, our hair, our face, our scalp, our kneecaps, our ligaments, our tendons. So we know that it is of utmost importance to really get that activated and working. Microneedling is the only device on the market. It stimulates the true collagen, collagen 1. And it's because we're activating the full wound healing cascade effect without any thermal interference. So one thing that you'll note with our protocols is we do not want heat to remain in the skin. What does heat cause? An inflammation. We want that wound to heal as quickly as possible. We're going to start to get into our demo. So depth and speed is something that I've already spoken about. It's not something that we're going to really talk about much here, but you are going to see me do her cheeks so that you can see how quickly I can actually do the cheek area. And then, of course, we talked about aftercare and how many sessions. Again, one microneedling treatment isn't going to be as effective as maybe 3 or 4. It doesn't matter what kind of treatment methodology it is. So when was the last microneedling treatment you've had?
It's probably been 6 months.
6 months? Okay. And I already went through the consultation about medical concerns. We're good. So I'm going to cleanse her face with what we call the Tri-Face Cleanser. It is a balm when you first take it out of the container, and you'll notice I have no water on her skin. So it is quite frankly a balm. So as you notice, it becomes like an oily type of cleanser on the skin. So it takes off all environmental pollutants, even waterproof makeup. If there's any other moisturizer or sunscreen on the skin, it does remove it. But then what you do is you add water, and it becomes a milky cleanser. You see that? You can probably feel it now. How does that feel on the skin, and how does it smell?
Nice, and it's very citrusy. It's very portable.
That's one thing about our product is that, believe it or not, it is not fragrance filled. So there is no added fragrance at all to it. And you're going to note something. I only use water at the beginning of the treatment. You are not to wash your face where I needle for 12 to 24 hours. That is a must. So one of the things that we do speak of a lot of the time is that cleansing is not enough. I know a lot of people with microneedling, they use alcohol swabs, but guess what? Guess how long you have to keep the skin wet with alcohol in order for it to do its job to sterilize the skin? Throw a number. How many minutes? 4 minutes of keeping the skin wet with 70% alcohol. Number one, they need an oxygen mask because it stinks. Number two, their acid mantle is just off. Number three, their skin needs to be at a fairly neutral pH before we even think about doing any kind of treatment. Dermapen World knew that, and they created my second favorite product, CliniPrep Plus. I literally travel with this. You can spray your airplane seat, you can spray it in your mouth if you have a sore throat. Hypochlorous acid stable, close your eyes, with colloidal silver. Hypochlorous acid and colloidal silver. Colloidal silver is antibacterial and antimicrobial right off the bat, but it's also very wound healing. So you're creating a wound. We are directly responsible for creating that wound, but we're just as responsible for healing that wound, right? So throughout the treatment, you're going to note that I probably will be removing excess Glide medium, or if there happens to be any blood in her treatment, off of the face with the actual mixture of the CliniPrep Plus. You feeling okay there? Mm-hmm. This sterilizes the skin in 15 seconds. One of the things that I like to show you, you're going to laugh at this too. Our needles clearly are in sterile packs, okay? Now, the needle actually comes in a sterile pack, but it has a nice little roller ball at the very end of it. There's a reason for that. It's not just to protect the actual needles. But when you put that in there, the little roller ball is great for autistic patients or neurodivergent patients or people that are very nervous about microneedling, because you can actually turn the device on. I drop this down to 0.5. I am going to do your full face. I'm going to do your forehead first. So again, they're quite liquidy. And you note that you don't need to use a lot of our Glide mediums. I like to use the side of the device just to get it going. And here we go. Horizontal, vertical. Now I'm going to get into her cheeks. And there we go. I'm going to go up to If they're using any vitamin A composites, then you want to make sure that they are not using it for 7 days prior to microneedling. In our scar therapy, the MGRAS, reverse aging and scarring, we do use retinol hide. Retinol hide is actually 800 times stronger than other tretinoins on the market. Partly because of its molecular composition, it is so tiny. It is the smallest molecule of the vitamin A family. We're done.
It is remarkable.
I get told all the time that on average, the actual irritation factor that you sense is actually very similar to being numbed with another device. So right now, she should feel kind of sunburned. That is absolutely appropriate. And just for you to know with this device, I always warn patients and clinicians, you should feel sunburn for anywhere from 48 hours up to 7 days. So I'm spraying the CliniPrep again, and then just removing the excess glide medium. All right, now, what we do post, normally I would put a peel. Yes, we have a microneedling approved peel. That peel actually has 11 different powerhouse ingredients in there. The glide mediums that we have created, not only do they have the botanical and chemical elements for cellular transformation, but anti-inflammatory as well, because we don't want inflammation. When we do the peel, it has the same idea. We've got tyrosinase inhibitors, you have collagen proliferators, you have hyaluronic acid in there, copper peptides, but also anti-inflammatory. But for purposes of today, I'm not going to do the peel on you. What we would normally do is leave that peel on for a max of 3 minutes. Now, if your client was asking about retinoids and they're like, oh, I did, and I stopped my retinoids like a week ago and they flare really red and they're really hot. No, they did not. But that's okay. What you would do is we have given you masks. Now, these are pretty special sheet masks. They are made of fabric. There's almost 30 milliliters of triple weight hyaluronic acid in one packet. That is insane. And you're going to see how the skin soaks it up. But you also have vitamin B5, you have sodium hyaluronate, you also have magnesium. So there's a lot of the soul food that you need in the skin, starting with the mask packet. Now, this is the other thing. The crazy thing is when we're microneedling, you're okay? Okay. When you're microneedling, you actually have 3 actions at a cellular level. You have the mechanical, yeah? We clearly have the mechanical. But then we have the chemical and the biological element within whatever glide medium that we're using, or if you're needling the PRP in. But because this device moves at such a quick speed, remember 1,920 puncture channels per second, the cells bounce against each other and then they're literally dissipating and spitting out all their natural hyaluronic acid, all their vitamins and minerals. So we have to replace that. If we don't replace that, the wound won't heal properly. The collagen regenerant will not be considered appropriate. So we all know what sheet masks are like. Good, but getting it on is hilarious. So right now, right away, we're dissipating the heat. You can literally feel the heat coming up and through the actual sheet mask. How's that feel?
Nice and cool.
Now, remember when I mentioned a little bit earlier that we can use the little roller ball for lymphatic drainage massage? I'm going to do that for you. It's very simple, very easy to accomplish. All you're going to do, the device went into Bluetooth mode, don't panic. You can go right back into treatment mode, even if you're in the middle of a treatment. So I'm going to go to 0.2 depth. I'm going to go to speed 1, because we're at speed 4, and then I'm going to turn the device on. And just move everything. So normally we'd leave this mask on for a good 15 minutes in the clinic. They can go home like this. A lot of the patients do, just as long as they have the 2 final products that you must put on the skin. You must put vitamin-rich repair on the skin, and you must put cover recover on the skin. Why? Absolutely nothing that holds the heat in the skin. There's a reason we suggest this. This is a second skin. This actually has 3 different kinds of silicones in it. So it actually is very wound healing, but it has anti-inflammatory elements, copper peptides included, and cooling products. So I'm going to press this into her skin.
I think I've absorbed.
She's absorbed a lot already. It's really quite impressive. Pressing a product into the skin is far more effective than massaging. The skin tends to kind of have this kind of like go away effect if you're massaging post-op. So I'm going to start with this much. Can everybody see that? Oop, tiny little bit of vitamin-rich repair. Massage, massage, and apply. Right away, you should feel even more cooling effect. With the Cover Recover, it's beautiful because you can layer. And that is very important, especially if you did a deeper treatment. Let's say that she did have scarring on her cheeks, and I was at 1.75 or 2 millimeters. You want to make sure you've got quite a layered effect. But also, this is a lunchtime treatment. Technically, she can go right back to work. Gone are the days of downtime. How's that feel?
Nice.
Whoever would like to come up and see her skin, we are done.